Assalamu alaikum, this is me, the Tafta. Today I'm here to present my topic, Candida. So first, let's talk about its classification. It belongs to family Saccharomycetaceae, phylum Ascomycota, which have approximately 200 species. About 20 species are associated with pathogenicity in humans and animals. Here are its major species. Candida albicans is the most commonly studied species of Candida. Candida is normally present in the body without causing any disease. Some of the opportunistic fungi affect those who have weak immune system. In those, the amount of Candida increase called candidial overgrowth, due to which they cause pathogenicity. Its morphology is divided into three categories as yeast, which is polymorphic, pseudohyphae, and hyphae. Habitat. It's ubiquitous, means found everywhere. Normal flora of human and animal body. Commonly lives in warm and moist area of the body. Mostly lives in gastrointestinal tract and vaginal area in females. In diaper regions in kids. Diseases. Diseases are subdivided into two categories. One are Mucocutaneous Candidiasis and other are deep-seated Candidiasis. Mucocutaneous Candidiasis is further divided into three forms: cutaneous candidiasis, nail infections, mucosal infections. So first let's talk about cutaneous infections. In this infection, skin infected with Candida skin become reddish and itchy. Commonly occurs in warm and moist areas of skin like groin. So what's groin? Groin is areas between legs. Nail infections. They are characterized by swelling, redness, pain in skin, supporting nails. Nails become discolored and brittle and hard. Mucosal infections. Infection caused by Candida on area which have mucosal membrane. There are two conditions in mucosal infection. First is oral candidiasis and other one is the vaginal candidiasis. Oral candidiasis. This is the most frequent form of candidiasis. Oral thrush is a common example, characterized by white lesions on gums, tongue, or mucosal membrane. Generally occurs in AIDS patients or people having weak immune system. Vaginal candidiasis. It is characterized by vaginal itching, pain and discomfort while urinating, abnormal vaginal discharges. So now let's talk about its transmission. Transmission takes place through oral contact in case of oral thrush mouth infection. In vaginal candidiasis, it transmits via sexual contact from female to its male partner. Here comes the deep-seated candidiasis. When Candida spread to the visceral or internal organs can cause serious infections. Spread hematogenously, it means via blood or through medical devices like catheter. Types of deep-seated candidiasis. Candidiasis of gastrointestinal tract, candidiasis of central nervous system, candidiasis of respiratory system, candidiasis of renal system, candidiasis of cardiovascular system. Laboratory diagnosis. The laboratory diagnosis for mucocutaneous and deep-seated candidiasis are divided into two different categories. In case of mucocutaneous candidiasis, samples are taken from skin, nail, or mucosal surface, which includes two steps. First, direct examination of specimen of fungal presence, isolation of fungus and its identification. In case of deep-seated candidiasis, it is difficult than mucocutaneous. Includes direct microscopy, isolation and culture, immunodiagnosis. Thank you very much.